What is Dacryocystitis? It is an inflammation of the tear sac located in the inner corner of your eye. It's often due to blockage of the tear duct that leads to tear from the tear sac into the nasal cavity. An infection can cause pain, swelling, watery eyes, and discharge. So, dacryocystitis is the clinical name for inflammation or infection of the lacrimal sac. The lacrimal sac is located between the corner of the eye and the bridge of the nose. It is responsible for holding and releasing our tears. The lacrimal gland constantly releases small amount of tears to keep our eyes lubricated. Whenever you blink, the tears are spread across the eyes, keeping them clean, moist, and healthy. Attached to the lacrimal sac is the nasolacrimal duct. The lacrimal sac works as a channel to drain tears from the eye to the nasal cavity. Sometimes tear duct becomes blocked due to infection, trauma, inflammation, or any other factor. When this happens, your tears are unable to drain correctly. So ultimately, this causes the tears in the lacrimal sac to become backed up and stagnant, allowing bacteria to grow and infection to develop. So it can be acute dacryocystitis or it can be due to chronic dacryocystitis, which is determined by how long the condition lasts. In acute dacryocystitis, symptoms will develop quickly and be more severe than chronic dacryocystitis. However, symptoms will typically resolve in less than 3 months or even as little as few days with antibiotic treatment. In chronic dacryocystitis, symptoms appear gradually and are more milder than in case of acute one. In fact, it's possible for the only symptom experienced to be eye watering and discharge. Now, coming to the causes of dacryocystitis. Dacryocystitis is typically caused by a blockade in the nasolacrimal duct. This reduces tear flow and leads to bacterial growth and inflammation. Now, conditions that cause a tear duct blockage includes the following. It can be sinus infections, particularly in the maxillary sinuses located beneath your cheeks near your nose. Abnormal tissue growth or tumor in the nasolacrimal system. Nasal inflammation or any abscess. Trauma to the affected region. Dacryocystitis symptoms vary depending on whether your condition is acute or chronic. As mentioned earlier, acute symptoms will appear quickly and may persist for up to 3 months. These symptoms include fever, pain and redness in the inner corner of the eye, yellow or greenish discharge, swelling and in severe cases, bruising in the inner corner of the eye near the nose is also noted. Watery eyes and redness may be noted in the cases of dacryocystitis, especially in acute ones. Symptoms of chronic dacryocystitis are not usually as severe as in acute cases. The most common symptoms observed are excessive tearing and eye discharge. Fever and inflammation are not typically present in chronic dacryocystitis as seen in acute chronic dacryocystitis. Now, coming to the treatment, it is important to see your doctor if you suspect that you are experiencing dacryocystitis. Treatment for acute dacryocystitis mainly consists of antibiotics which kill the infection causing bacteria. Antibiotics can be administered orally topically with an ointment or in severe cases intravenously. Symptoms should resolve fairly quickly once antibiotic treatment begins. You can relieve swelling or pain associated with acute dacryocystitis at home as well. For example, your doctor may recommend